So as many of you are probably aware, last week some new guidelines were posted on the COVID portal regarding how we're moving away from the paradigm of early intubation for patients who fail the regular nasal cannula at 6 liters, and instead going with a non-rebreather at 15 liters, and then if they fail that, a humidified high-flow nasal cannula up to 25 liters per minute. Non-rebreather and high-flow nasal cannula aren't nearly as bad as we initially thought in terms of aerosolization risk, but it's still not zero risk. So particularly when we're taking these patients out of their rooms and moving them through the hallways up into the floor, we want to limit the amount of potential virus going into the ambient air as much as possible. So the first part of this video will show the transport tent that we're going to be using for patients going up to the floor on a non-rebreather. I would note that patients requiring humidified high-flow nasal cannula in the ED to maintain adequate saturations will actually need to be taken off of that setup because we can't transport patients on it just in terms of the way it works. So they'll need to go on a non-rebreather, but then to give them a little bit more oxygen, they'll get a regular nasal cannula at 6 liters underneath that. But this will be for those patients on non-rebreathers going up to the floor. It shouldn't really be needed for patients who are intubated because they're on a closed system, including that viral filter attached to the tube.
This slides, the triangle part slides right underneath the mattress. So right about there. Plug in there. And if you have help, this is even better.
So these sheets are about 7 by 8, but it honestly doesn't really matter which side you put them on. They should be fine for length and width.
And up here towards the transporter, and you can actually take the slack and tuck it under the mattress up here, just to make it airtight by the transporter. And down here is kind of fine. You don't have to tuck this in. You want actually not to be a sealed unit. And anybody going up with this on obviously should have a nurse go with them.
Yeah, this is obviously like, we probably don't want it to be airtight just so the patient doesn't build up too much CO2. 15 minutes, 10 minutes, transport should probably be fine. But you may just have to like loosely tuck it in around the patient just so it doesn't drag on the floor.
These will be up so you can probably just put it like that.
So the other use of this is this can be used as an intubation frame. So we're going to use the intubation drapes that we have. Now, we're asking the labor pool to cut these a little bit wider, and that should be done hopefully by tomorrow, so I will send out an email regarding that. Just because these are a little bit short on the sides, shorter than I would like to give full protection, but we'll get those a little bit wider. But this kind of, I think, gets the best of both worlds with the drape and the box. It's a little bit more flexibility than with the box, or a little bit more flexibility than with the box, and you got a little bit better of a seal, I think, around your hands here than with the box, but it's got the structure of the box. So chest port is still there. It's a little high, but we're just going to keep it for now. And yeah, you do your same thing as you would before. Your hands go in here, patients can be down here. Just go ahead and intubate. And when you're done, whether it's the intubation drape or the transport tent drape, just make sure that you're trying to dispose of this in a relatively kind of clean fashion. Consider the inside of the drape contaminated. So you can just pull this off and just kind of roll it in on itself. Okay. And then just toss it in the garbage. Just make sure that after this is used, that this is definitely getting wiped down with virucidal, bactericidal wipe.
So this is the intubation box that was just sent to us. As you can see, the hand ports are at the top of the patient's head. The intubator's hands go through there. If you couldn't see this from the other side, or from the other angle, this side is actually open. There's a little thing right here, but most of this is open. So respiratory therapists can hand you your tube from that way. Other assistant can provide cricoid pressure or whatever. Obviously there's less protection there, so probably your assistants want to be standing a little bit more towards the side of the patient rather than towards their feet. So personally, I think I probably will be using the drape more often, especially when we have the drapes cut a little wider, hopefully tomorrow, to go over the intubation frame. But people should certainly experiment and let us know what they think works best.
So the intubation box should be stored at the bottom of the shelving in the ILI unit between rooms 24 and 25. Just above that, that's where we already have the spare intubation drapes, but to the right of those will be where the transport tent drapes go. We'll have more of those hopefully tomorrow with the labor pool cutting them. And then
to the right we have the transport tent / intubation frames. Up on these hooks here, we have 5 of them out right now. There are a couple more available, but we really want to try to reuse these. Don't lose them. Bring them back to the ED after you're done bringing your patient up to the floor, and make sure you clean them.